Everyone. Yes, my name is Magdalene. My name is Magdalene Busieka. Yeah, I work for Hostess Empowerment and Support Program. I'm field officer and also sex workers activist. So, for my abstract, I was relating, or rather I talked what Bar Hostess is doing in making sure that we have, or rather the sex workers, they do access to this universal health coverage and other perspective. So, just if I may start off the background information of Bar Hostess Empowerment and Support Program, which is BEST. BEST is an organization for and by sex workers, women having sex with their fellow women, women using drugs and bar hostess in Kenya. It was founded in the year 1998 by a group of these vulnerable women as a loose association to advocate for their rights recognition. Now, BEST mission is to influence policy and facilitate provision of quality health services, human rights awareness, legal services, and economic empowerment for this particular population. So, BEST it has also engaged these women in Kenya in HIV prevention, care and treatment support, gender-stroke human rights awareness, advocacy, and economic empowerment. Now, the organizations also serve as a common voice for this vulnerable population in efforts to reduce stigma and discrimination while engaging stakeholders in advocacy and policy dialogue. Yeah, that's the logo. Next. No, what's the mission? So about the mission we saw during the background information. So next. So if I may talk about the core values, what Bar Hostess do to have these women in place. Now, when you talk about sex workers, let's first of all talk of excellence. We believe in excellence, that everything we do, when it comes to providing biomedical services, we believe in quality services. We believe that with excellence, we are going to be somewhere. Empowerment. So, when I talk about economic empowerment, how are we empowering these women? We do empower them economically and socially. And also, for those women who are experiencing violence, we give them skills. We take them through sensitization. That is professionalism. So that by the end of it, they are able to come up with negotiation skills when it comes to condom negotiations, when it comes to their clients, when it comes to how these women are going to access their services. So that, and also, we will have a free environment whereby these women will not be discrimination. They will be free from discrimination and all this. So, just like as we said, how are we going to achieve our objective? The Bar Hostess objective is to serve as a focal organization and voices of these sex workers, women who are having sex with their fellow women using drugs and bar hostesses in Kenya. And also, it serves as a linkage to services on key issues affecting women. So, apart from just promoting this behavior change of sex workers, BEST also strive for justice and the welfare of this particular population, so that by the end of it, they'll be able to claim their rights and know what they are supposed to do. when we look at the recent report about HIV, it has stipulated that HIV has been very rampant in Kenya, especially in adolescents and young people. That is AIP, with lots of stigma and discrimination associated from the community. Yes, in many communities in Kenya, those AYP infected with HIV are considered outcasts within the society, rendering them more vulnerable to infection. That is like limiting illness or societal cases. Yes, it is true that for the last 2 years, Kenya has reported an increased number of new HIV infections, especially for the AYPs of ages 15 to 29. So, causes are these: poverty, peer pressure, and lack of awareness. They are major contributing factors to HIV exposure, whereby AYP engage in unprotected sex without figuring out the consequences. Now, how is best intervening? Now, to curtail these challenges faced by the AYP, now, best through other stakeholders has formed a more intersectional advocacy team to sensitize these young women on issues related to HIV with UHC Incorporated. Now, with this we have a dream project through Faria Jamii, which started in July 2021, aiming to support 4,105 girls with biomedical services, psychological support, social economic support, and economic empowerment, and the period which was 1 year to end by July 2022. Now, what are our areas of implementation? We do offer services Magare, Korogocho, Dandora, Mukuru kwa Ruben, and Mukuru kwa Jenga, all those areas. So what are some of the methods that we apply? So now through we did a one-on-one interviews. We met with these adolescents and young people, and they had a lot to tell us through outreaches, fieldwork, and research and all that. Experience sharing and community dialogue, research with key actors such as law enforcers, and the Nyumba Kumi initiative. Now, these areas, they are prone to having young people being combated with the virus. So according to our research, according to the research that was conducted on May 2021, we found out that out of 30 girls, at least 21 of them were either HIV positive, young mother, school dropout, or jobless. Now, this meant that 70% of these young people, they were yearning for help. During our one-on-one discussion, we found out that the main reason as to why these young women engage in sexual-related behaviors in their early age, it was because of their economic status, which forced them to become sex workers at their tender age with no skills when it comes to condom negotiations or even payment. Now, due to lack of these skills, the girls could end up being coerced, ridiculed, or even rebuked by their clients for choosing mysterious path. Some of these men could have sex with these young people and also refuse to pay them because of stigma and holistic approaches in the communities that these women could do nothing to claim their rights except what? They just sit down and vegetate. So, let's talk about the best mindset. What has best done? So, we have a budgeted advocacy approach, and the reason is to increase the allocation resources of health dockets at national and devolved government level, whereby we focus on increasing equitable access as the most important principle in universal health coverage, ensuring that young people, especially marginalized population, have access to health care and fully realize their health rights. And also we ensure that no one is left behind, whereby best involve the community in making decisions, as well as meeting with state actors to help in identification of gaps in the adolescent and young people journey. So who are these state actors? Now, the sub-county health management team, whereby the sub-county health management team, they include the SCASCOs, the MOH team, whereby we meet with them, we bring our issues to their table and make rapport with them, so that in terms of maybe there's a crisis in terms of medication, so that they consider us first. About the law enforcers, we normally have the CAB meetings whereby we sit with the police, the officers, and all that. After hearing the issues and what sex workers are facing, through that they will make friends. That is through the CAB meeting. They will make friends, whereby we also have a deeper plans, whereby we go to the police station, we do the clinics and all that. Now, division of tasks. So when I talk of division of tasks, is how we normally operate. When it comes to the outreach workers, the peer educators, so specifically if I talk for Modern Dice, it has 60 peer educators and 60 outreach workers. And also, we have 2 paralegals. So, next. For the paralegal, they play a very key role in this case in terms of maybe when it comes to knowing rights campaign, whereby they seek intervention from clinical team and advocacy officers in case of any GBV-related cases. And also, they organize CAB meetings whereby they meet with the SCASCO, the law enforcers, the pastors, the border riders, and also YKP representative, be it outreach worker or peer educator. And through this discussion, the aim of this discussion is just to build a rapport and understand the challenges that these sex workers do face, so that this population be free from stigma and discrimination. So this it's just a peek whereby the paralegal team, they were at the police station helping in the clinics, aiming to make friends. Next. The role of the peer educator, assessing the needs of adolescents and young people. What do they need in terms of medical access, in terms of condoms, in terms of other related trainings? They also offer health education about PrEP, about STIs, about PEP, about cervical cancer screening. They submit monthly reports and all that. So also this is a peak whereby the peer educators and sub-Victoria peer educators and the outreach worker, the clinical team, they were given bags from courtesy of Faharia Jamil, bags to carry commodities such as condoms. So, in order to entice this particular population, we normally carry out PLHIV support groups that is done twice a month, PrEP support group twice a month, and we also introduce food program that is the budget is the budget is allocated for food program, and it is normally done quarterly. Yes. So this is just a theme day. Theme day is done twice a month, twice a week, whereby we have Juice Tuesday, Pilau Thursday, and we can. So this was a combination of theme day and PLHIV support group. So this, as you can see, there's Juice. This was Juice Tuesday, as well as there are some talkings going on, some sensitizations, apart from just receiving juice. So this is educators training on social mobilization the role of the educators is to attend related trainings. The food program, that one I talked about quarterly. So differentiated service delivery, we have the outreaches, the case finding. Outreaches is whereby you take the biomedical services to the community, maybe to help those who are not able to come because of distance issues, maybe because they were busy. So it's up to us to give the package or to take the services where the clients are. Next. So that's community outreach. And I talked of youth-friendly services. What are these services that normally attract the youth? The theme days that we saw this Tuesday, the Pilau Thursday, the movie, Friday, the pro bono lawyers. So if that happens in case of maybe illegal arrests, maybe loitering, the pro bono lawyers, they normally come up to stand for the young sex workers. The safe space. Safe space is just a free space. These people, this population or the girls, they usually come to safe spaces whereby they are free to mingle, they are free to receive the Wi-Fi, and also they are free to even talk to the staff who are also young, just like them. So, the trainings, we talked about it, of the educators and all about that. So from our findings, we normally have CREW website, whereby CREW is working to reduce harassment and discrimination against commercial sex workers. We work directly with sex workers to educate them on how human rights law as well as Kenya law apply to them, to support them to mobilize and act on issues of concern, aiming to create a more productive and less antagonistic relationship between themselves and both police, city, and council officials to date. CREW assistants as less than 35 sex workers are acquitted of unfairly leveled charges. That CREW is a board. It's more of it's like a board that fights for the rights of sex workers. Yeah. So we say that we also train sex workers to provide voluntary counseling and testing services. We also train sex workers as peer educators at the clinic. That means that peer education is the cornerstone of bar hostel. So 50% of the staffs, they are either sex workers or former sex workers. So what are some of the challenges that bar hostels or rather sex workers do face? It's the access to justice. Access to justice, whereby sex work is criminalized in Kenya. So addressing this issue of sex work, it has really become a challenge. When sex workers are arrested, especially if they are young, it becomes a really challenge. They can't negotiate for themselves. So access to justice has really become a very big challenge. The serial murders. Every day we see sex workers are being killed by their clients, maybe by the police, and all over. Serial murder. So, if I may talk about what happened after that period, that 1 year between between August 2021 and May 2022. So, we were able to receive biomedical services with ease, and this represents the targeted population. So we were able to give services, how many? 3,115 AYPs were able to receive these biomedical services. And also, health education and peer-to-peer sensitization have made the AYP to know their rights and also realize the importance of self-care and prevention. Yes, called Tutaweza, meaning we shall make it, a coalition that aims to ending HIV/AIDS among AYP by 2025. Yes. Some of the conclusion on the key things that we need to consider is that active participation, meaningful engagement, and economical empowerment of youth contribute to their growth in health sector. And also, when key actors, be it the allies, the opponents, and the undecided ones, when the key actors of common interest unite, realization of universal health coverage among the youth becomes a priority.